A man is lying on a wooden table. His wrists are tied to iron rings bolted into the frame. For other men are holding down his legs, his shoulders, his head. Somewhere behind him, a fire is burning, not for warmth. For the iron rod resting inside it, waiting. He is fully conscious. He will remain fully conscious for the next 11 minutes. This is not a scene from a horror film. This is a Tuesday, in a hospital, sometime before the year 1846. And what happened on that table was not the exception. It was the standard. Most people assume surgery before anesthesia was simply painful. That word is doing an enormous amount of hiding. Pain implies a sensation you endure and then move past. What patients experienced on 19th century operating tables was closer to a controlled act of violence performed on a person who could feel, see, hear, and remember every second of it, and who had agreed to it, because the only alternative was worse. That distinction matters, because once you understand what conscious surgery actually required, the story stops being about medicine. It becomes a story about what the human mind does when the body is being destroyed in real time, and there is no way out. Picture the operating theater itself, and take that word literally. Theater. Surgeries were performed in rooms with tiered seating, like a lecture hall, because they were watched. Medical students crowded the balconies. The public sometimes bought tickets. A surgeon operating on a screaming patient was, in a very real sense, giving a performance, timed, choreographed, judged. Speed was not a preference. Speed was the entire craft. The most celebrated surgeons of the era were not praised for precision. They were praised for velocity. One Scottish surgeon, Robert Liston, became famous for amputating a leg in under 30 seconds, so fast that legend claims he once amputated a patient's testicles by accident, mid-swing, because his assistant hadn't cleared the area in time. That story sounds absurd. It is repeated in medical history precisely because the surrounding reality was absurd enough to make it plausible. Here is the detail that should unsettle you more than the blood. Patients were not sedated into stillness. They were restrained into stillness. Teams of orderlies, sometimes 4, sometimes 6, existed for one job: pinning a human body down hard enough that a scalpel could move in a straight line despite everything that body was doing to escape it. Because the body does not accept being cut, even when the mind has consented. Even when the patient begged for the operation that might save their life, their muscles fought back anyway, on instinct, without permission. Consciousness and consent turned out to mean almost nothing to a spinal cord trying to survive. Most people assume patients were given something, anything, to dull the experience. Some were. Opium tinctures, high-proof alcohol, a leather strap to bite down on, which did nothing for pain and existed mainly to protect the patient's teeth and tongue. None of it worked in any meaningful way. Alcohol thick enough to blunt surgical agony was also thick enough to induce vomiting, and a vomiting patient on an open abdominal wound was its own catastrophe. So surgeons, quietly, learned to underdose. A slightly drunk patient who could still breathe steadily was safer than an unconscious one who might choke. The horrifying logic underneath that decision, keeping the patient aware enough to survive their own pain, was, medically, the responsible choice. Now scale outward. This wasn't an unfortunate footnote in a handful of unlucky cases. This was every amputation, every tumor removal, every attempt to set a shattered bone that had already begun to rot. For thousands of years, across nearly every civilization capable of performing surgery, this was the ceiling of what medicine could offer a dying body: a fast blade and enough hands to hold you still. Which means the deeper subject here is not surgery at all. It's endurance. What a nervous system does when annihilation is imminent, unavoidable, and fully witnessed by the person it's happening to. In 1811, the English novelist Fanny Burney underwent a mastectomy without anesthesia and later wrote privately about the experience. She described losing her sense of the room entirely. The walls, the surgeon's face, even language itself dissolving into something she could no longer organize into thought. Researchers studying historical accounts like hers have noticed a recurring pattern. Patients frequently reported a kind of psychological splitting mid-operation, an experience that sounds, in modern clinical terms, remarkably close to dissociation. The mind, unable to stop the pain, appears to have done the next best thing. It tried to leave. This is where the story stops being historical and becomes something closer to philosophical. Because what these accounts describe is not simply suffering. It's a mind encountering the absolute limit of its control over its own experience, and improvising a survival mechanism nobody had to teach it. Dissociation wasn't a symptom doctors induced. It was something the brain manufactured on its own, in real time, because raw awareness was unsurvivable. That should reframe how you think about consciousness itself, not as something stable that simply receives the world, as something that can partially disassemble itself, on purpose, the moment reality becomes too much to hold. Surgeons of the era were not sadists. Most of them were haunted. Diaries and letters from 18th and 19th century physicians reveal a recurring private torment, the sound. Surgeons wrote about being unable to forget the screaming long after the patient had healed or died. Some described developing what we would now recognize as symptoms of trauma themselves, from performing the surgery, not receiving it. Pain, it turns out, does not stay contained inside the patient. It radiates outward into everyone standing close enough to witness it. The operating theater didn't just extract disease from bodies. It left a residue in the people doing the extracting. Then, in October 1846, in a surgical theater in Boston, a dentist named William Morton administered inhaled ether to a patient before a tumor removal, and the patient felt nothing. Nothing. The surgeon operating that day, Dr. John Collins Warren, reportedly turned to the audience afterward and said something to the effect that this was no humbug, a phrase that entered surgical folklore precisely because of how radical the moment felt. For the first time in the history of the species, a human being had been cut open and had simply not been there for it. Within a few short years, the technique spread across the world, and an entire category of human suffering, one of the oldest and most universal categories that existed, simply stopped. Sit with that for a second, because it is stranger than it first appears. For the overwhelming majority of human history, on every continent, the experience of needing surgery and the experience of enduring unbearable, fully conscious agony were the same experience. Indistinguishable. Then, within a single generation, they were severed. A person could need to be operated on and simply not suffer for it. That has almost never happened to a form of universal human pain. War didn't end. Grief didn't end. Fear of death didn't end. But this one specific, ancient, guaranteed agony ended almost overnight because of a gas. And yet, anesthesia didn't erase the earlier chapter. It just moved it out of the operating room and into the historical record, and into the bodies of everyone who lived and died before 1846, whose experience of medicine's limits was written directly onto their nervous systems, with no exceptions and no mercy. Every scar from that era carries something modern medicine rarely has to reckon with anymore. Proof that a person was awake for what created it. Maybe that's the real discomfort underneath this story. Not that surgery used to hurt. Everyone already knows pain exists. What's harder to sit with is this. For most of human history, relief itself hadn't been invented yet. Not because no one wanted it. Because no one yet knew it was possible. Which means somewhere, right now, there is very likely a form of suffering, physical or otherwise, that future generations will look back on the way we look back on the operating theater. Something we currently accept as simply how the body works. Until, one day, someone discovers it didn't have to be.